This week, Dr. Vilfort will be talking about stomach. Why? The stomach is part of the digestive system, and it has a hollow J shape connecting the esophagus to the small intestine. When I'm talking about the stomach, number two is in my mind. Why? Is because the stomach has two borders, two openings, two surfaces, and two curves. And the stomach, after receiving the food, first has to store it. After that, is like sending a message to the gastric enzymes to come and mix with hydrochloric acid to break down the food in smaller proportion. And they break down the food, they mix it until they grind it until it get to the what we call in medicine chyme. And after converting the food in chyme, it will send it to the small intestine. We have to say the stomach is the most dilated part of the digestive system, and also the stomach has a pH between 1 to 5. That means the gastric pH is acid. Remember, pH could vary from 1 to 14. When you get to 7 is neutral, less than 7 is acid, and more than 7 is alkaline or basic. That means in the stomach, the pH is acid. And because of that, the carbohydrates digestion will be interrupted at that level. Why? Because they need a pH higher than 5 for their digestion. And because of that, they couldn't or they will not be digested in the stomach. But other ingredients such as protein, fats, and alcohol will be partially digested in the stomach. And why some people will not be able to digest properly? That could be different reasons, but we are going to mention only 3 of them. The first one is going to be if you are under a lot of stress. The second one, iron deficiency. And the third one, magnesium deficiency. And when you are not having a normal digestion, we can refer to indigestion or dyspepsia. And when people have dyspepsia, they can have heartburn, hiccup, and also they can have bloating stomach. Could we say whenever you have that is because of this is a concern to go to the doctor? I will say not necessarily. If something happened like sometimes or not very frequently, I think that could be a message that you are not digesting properly, but there is no need yet to go to a doctor. But if that is taking place continuously, yes, you should go. But what happens when people cannot digest properly and that occur again, and again? That could be very, very, very problematic. You should be concerned because that could be part of a long process of other disorders in your stomach. We are not going to mention them, but they are a long list. There is a long list. And for today, we are going to stop, and I'm sure it's not the last time we will be referring to digestive system, because like I said before, your digestion start in your mouth and finish in your anus. See you next time for another presentation.